This video will provide a comprehensive study and exam strategy guide for Pharmacist Intervention Mastery, specifically for the PTCB 2026 exam. Let's distinguish an adverse drug event, which requires causality and harm, from a side effect, which relates to known pharmacology. As a pharmacy technician, your role in ADE reporting includes capturing details, documenting de-challenge, verifying credentials, and submitting via MedWatch protocol. For exam strategy, be aware that drug utilization review may be called therapeutic review or safety screen. Avoid the double negative trap. Use the mnemonic 3 DAP dose, drug, duplicate, allergy, and pregnancy to quickly recall issues requiring pharmacist intervention. Technicians' scope of practice for OTC recommendations is limited to locating products and reading labels. Never diagnose conditions, recommend doses, or suggest treatments beyond the label. Always refer clinical questions to the pharmacist. Generic substitution is automatic if A/B rated, while therapeutic substitution requires prescriber approval and a new prescription. The technician duty checklist includes verifying NDC changes, updating MAR, and labeling with substituted by pharmacist initials. In this scenario, a technician recommends pseudoephedrine to a patient on phenelzine. The correct action is to alert the pharmacist due to the risk of hypertensive crisis, as MAOI interactions mandate pharmacist intervention. When flagging a C2 stimulant misuse concern, the technician's protocol includes calculating the day's supply gap, printing the history, and handing off the data to the pharmacist. Technicians do not have refusal authority. For packaging errors in adherence aids like blister cards, the technician identifies the error, but the pharmacist must perform the correction. Misuse of adherence aids still counts as misuse and requires pharmacist intervention. For early refill requests of C3 controlled substances, the technician calculates the gap. Although a C3 may allow a maximum of 7 cumulative days early, a chronic pattern of early requests must be escalated to the pharmacist. Following immunization, the technician's role involves a mandatory 15-minute observation period, monitoring for syncope. In case of an adverse event, alert the pharmacist immediately and document the time and interventions in the vaccine log. For allergy cross-reactivity scenarios, such as penicillin and cephalosporins, the technician must flag the allergy in the system. Never override an allergy alert, even if the prescriber writes, "OK," always involve the pharmacist. If a patient collapses after an immunization, the technician's first action is to call the pharmacist immediately. Syncope requires professional assessment to differentiate between vasovagal response and anaphylaxis. When a CYP3A4 inhibitor interaction is flagged, the technician must print the interaction sheet and attach it for pharmacist review. A critical action is to never counsel the patient on interactions. St. John's wort is a common interaction flag as it decreases levels of drugs like digoxin and warfarin. Any interaction alert requires pharmacist intervention. Document herbal use in the patient profile. In this practice question, a patient on warfarin requests aspirin. When the interaction alert fires, the next step is to alert the pharmacist. Bleeding risk requires clinical decision-making, not technician counseling. For safety questions, use time management and keyword scanning. Prioritize choices with terms like consult or interaction. The process of elimination requires you to select the option with pharmacist involvement first. Memorize key terms like DUR, ADE, syncope, anaphylaxis, and interaction. Any stem containing these terms demands the pharmacist intervention option. For exam day, remember the night before checklist and the on-site tools. Use the mnemonic 3 DAP plus HI dose, drug, duplicate, allergy, pregnancy, high alert, and interaction. Avoid exam traps by reading every answer choice and watching for subtle double negatives.